Hi guys, welcome to the DSP supplemental training on identifying and responding to choking risks and choking events. These are the learning objectives for the training: defining choking, reviewing the signs and symptoms of choking, identifying the things that can increase the risk of choking, like chronic conditions, foods, types of medications, identifying the healthcare professional who is able to assess swallowing issues, identify behaviors that may increase the risk of choking, and what to do in case of an emergency. Choking can be defined most simply as an obstructed airway and could be caused when a foreign body obstructs the airway, or food and or a combination of food and drink obstructs the airway. Choking can be to an intentional act, such as eating something or placing something in someone's mouth intentionally, or an unintentional act, like when a kid is really small and still learning and putting a lot of things in their mouth. The choking can be partial or complete, and it could be related to age or other chronic neurological or neuromuscular conditions. Increased risk of choking may also be related to alcohol consumption, medications, dysphagia, which is difficulty swallowing foods and liquids arising from the throat or esophagus, ranging from mild difficulty to complete and painful blockage. It could be from decaying teeth, poor positioning, or behavioral concerns. Choking typically occurs when eating. The correct food path leads to the stomach, where food is digested. The incorrect food path leads to the lungs, resulting in choking if the airway is blocked by food, drink, or foreign objects, or aspiration if food, drink, or foreign objects are breathed into the lungs. Symptoms of difficulty eating and swallowing. Difficulty creating a lip seal around the fork or spoon. Difficulty with solid foods, coughing before, during, or after swallowing. A choking sensation, shortness of breath, watery eyes. Changes in voice quality after swallowing. Heartburn, weight loss, vomiting, burping. Repeated pneumonia. Abdominal pain. Those are all symptoms of difficulty eating and swallowing. Some other conditions can also increase the risk, which would be a history of aspiration pneumonia. Constantly having things down in your lungs, liquid down in your lungs, increases the risk of choking. Having GERD or a history of GERD, Parkinson's, seizures, Alzheimer's, cerebral palsy, multiple sclerosis, Prader-Willi syndrome, dysphagia, Down syndrome. Dysphagia is a condition in which a person has difficult or abnormal swallowing. It can also mean that it hurts to swallow or swallowing is unsafe. Down syndrome is a condition in which a child is born with an extra copy of their 21st chromosome, hence its other name, trisomy 21. This causes physical and mental developmental delays and disabilities. Then there's Prader-Willi syndrome, which also has a high risk of choking. It's a complex genetic condition that affects many parts of the body. In infancy, this condition is characterized by weak muscle tone, feeding difficulties, poor growth, and delayed development. Beginning in childhood, affected individuals develop an insatiable appetite, which leads to chronic overeating and normally obesity. The risk is increased for individuals with Down syndrome because they lack tongue control and frequently have an underdeveloped jaw, leading to impaired chewing and poor ability to use their tongue thrust to assist during swallowing. They are at an exceptionally higher risk for choking when compared to other genetic disorders. And individuals with Prader-Willi have poor oral and motor coordination. They have a poor gag reflex, abnormally strong sensation of hunger, and are very motivated by eating. So they have decreased chewing and more voracious eating habits, maybe more quick When they're eating bigger bites, higher risk of choking. Heimlich maneuver training, eyes-on supervised meals, and food preparation and diet modification recommendations via an assessment with a speech pathologist to avoid high-risk choking textures and foods is recommended. Then there's medications that increase the risk. Antipsychotic drugs, medications that affect your throat muscles, antihistamines, anything that causes a dry mouth, anything affecting the central nervous system, anything that lingers in the throat, anti-cancer drugs, or high-dose steroids. Always read the side effects. Structural abnormalities can be congenital or acquired and may increase the risk of choking. So cleft lip and palate are examples of congenital structural abnormality that can increase the risk for choking. There could also be tongue dysfunction or high palate. Somebody who is tongue-tied or has not had a surgery to correct a tongue tie could be at a higher risk of choking. Poor oral health and chewing difficulty increases risk. So loss of teeth reduces chewing performance, resulting in most of the food not being safe to swallow, too large, not mushed up enough. Loose or decayed missing teeth all increase the risk of choking or an airway obstruction. Then there's eating disorders that increase the risk. There's avoidant restrictive food intake disorder, which is very limiting to the amounts of food and types of food that a person consumes. There's pica, which involves eating items that are not typically edible, such as paint chips or chalk, hair, dirt. Those things, they don't contain a significant nutritional value, and they aren't food, but individuals with pica do engage in eating these sometimes odd things, so that can increase the risk of choking. There's rumination disorder, which is constantly regurgitating your food and possibly rechewing it, reswallowing it, or spitting it out, which is also an increased choking risk. Some behaviors that increase the risk of choking: putting too much food or too much medication in someone's mouth, not chewing well enough, portions are too big, eating too fast, drinking too fast, not paying attention while eating, swallowing food whole instead of chewing, isolating behaviors, food stealing. Those can all increase risk in choking. Some individuals feel embarrassment related to their eating. They may move away from others or want to eat meals alone or in bed, but isolation increases risk for choking. So be alert of those individuals who may choose to leave the dining area and check on them regularly to ensure that they're not in need of any assistance. Eating behaviors may increase choking risk. Teacher staff, all DSPs must be aware of high-risk eating habits like stuffing food in one's mouth, isolation. If high-risk eating behaviors are observed, let staff know to notify their direct supervisor and document the incident. And then the individual's doctor should be notified if any high-risk eating behaviors are observed. If a choking incident is related to the individual's high-risk eating behaviors, a referral to a behavior specialist, such as a BCBA, a board-certified behavior analyst, or a positive behavioral supports facilitator might be needed. Where can you get help? All of those at an increased risk for choking and/or aspiration for any condition mentioned on the previous slides, or any other which puts them at higher risk, should be evaluated as soon as possible by a healthcare professional. Schedule an appointment at your earliest convenience for a referral to the appropriate specialist. The individual's doctor will know which specialist to best assist and assess the individual's particular condition or their choking risk. Speech-language pathologist, ENTs or ear, nose, and throat doctors, and gastroenterologists all specialize and can assist in choking and choking risks. Healthcare professionals may advise that the individual should maintain a neutral head position that allows the airway to remain closed while swallowing. While assisting an individual to eat or drink, hold cups and utensils level to the individual's mouth, not up too high and not up too low. Holding a cup too high will cause flexation of the neck, which opens the airway, putting an individual at greater risk of choking and aspiration. You should also avoid certain foods and beverages if instructed to do so by a healthcare professional. An individual may need special thickeners or drink thickened liquid to assist in staying hydrated and lessening choking risk. Avoiding hot or cold beverages. They may refer to a dietitian or a nutritionist, and then they may order for diet modification. The bottom line is that everyone is at risk for choking. Individuals with developmental disabilities are at a higher risk for choking. Everyone needs to be certified with CPR and first aid and the process of administering back blows and abdominal thrusts for choking emergencies. This training should be hands-on. Caregivers should do practice drills or mock emergencies to reinforce emergency protocols. Practicing emergency protocols and allowing direct caregivers the chance to ask questions builds confidence and improves response technique. Repetition of any activity increases muscle memory and gives participants a chance to improve reaction response times. Well-placed posters with clear instructions on the steps for caregivers to follow during an emergency can serve as a visual reminder and help calm caregivers when/if they begin to panic when an individual is choking. What not to do. Do not rush mealtimes. Plan other activities during mealtimes. Permit eating or drinking while the individual is lying down. Do not give foods or liquids that a particular individual has difficulty swallowing. Do not assist individuals to bed for at least 30 minutes after eating or drinking. Do not give foods or liquids restricted by the healthcare provider. Do not start mealtime if the individual is too lethargic, angry, anxious, or if they cannot sit still. And do not let an individual finish eating a particular food item if that food item has just caused the individual to choke. Foods that are considered high risk for choking: corn, grapes, bananas, hard nuts, marshmallows, peanut butter, chicken with bones, candy with large nuts, whole hot dogs, whole hard fruits like apples or pears, peanut butter sandwiches on soft bread, so thick, chewy bread and sticky peanut butter is not a good idea. Any thick, chewy bread is not a good idea. Whole raw vegetables served in large bite-sized pieces, dry meats without sauce or gravy, dry crumbly foods such as cornbread or dry rice, things of the wrong texture, eating something with 2 or more textures. Those are all things that could heighten the risk for choking. It's essential to consult the individual's doctor and speech-language pathologist to ensure a person-centered support plan and or choking protocol meets their specific needs. All person-centered support plans and or protocols must meet human rights guidelines and require approval with signature from a healthcare professional. Possible protocols could be how to handle pica precautions, how to do hands-on staff-assisted eating, direct visual supervision when the individual is eating, implementing doctor's orders for prescribed diets or for how to thicken food, how to limit access to food and how that impacts an individual's human rights. Any protocol that limits those rights requires approval from the local Human Rights Council prior to implementation. Ways to support. The universal sign for choking is both hands clutched to the throat. I am choking. That is what this means. Demonstrate the universal choking sign to individuals and teach them how to do it themselves if they are cognitively and physically able. If you are choking, do this. Have them demonstrate it to you at routine intervals to make sure that they remember how to do it and when they should use it. Did you know some people who choke can still breathe? The symptoms look like fear or panic, a red face, they're grabbing their throat, they're drooling, forceful coughing when they're trying to dislodge what is stuck. And some people who choke cannot breathe. Those people cannot speak. They get gray and pale in the face, their lips turn blue, they're usually grabbing their throat, and there's either no noise or a high-pitched noise. This has been your supplemental training on choking and choking risk. Do not forget to take the test below. Good luck.